So, we are very fortunate to have with us Megan Abbott. She's from the Pennsylvania Department of Health. As we all read about in the press and within our workplaces, the big focus of everybody is on the vaccine and that process. And so we are extraordinarily pleased to have Megan with us today, who's going to share just kind of the latest and what's going on with vaccines in the state of Pennsylvania. Megan?
Sure. Can you hear me okay?
We can.
Very good. Well, hi, everyone. Thank you for having me. My name is Megan Abbott. I'm the Director of Intergovernmental Affairs here at the Department of Health. I'm really pleased to be here today. I've been talking to many groups over the past couple days or weeks, really, about vaccine and, prior to that, about COVID generally. So we started this journey on March 6th with our first case, and here we are many months later, still working on this global pandemic. So I think to start, would like to just give a brief kind of lay of the land on COVID, and then we can talk a little bit more about vaccines, since I know that's the hottest topic. But just for some perspective, as of 10 p.m. last night, our number of cases today will be up 4,628. Bringing our total cases to 812,495. So we are still seeing cases. It does appear that we have plateaued a bit in Pennsylvania, which is making us feel cautiously optimistic. However, our team is keeping a very, very close eye on the new variants coming from both the UK, South Africa, South America. There's several that we've seen throughout the past couple of weeks. I'm sure you've been hearing in the news about it as well. Our hospitalizations are currently down today, 23. We have 3,887 people hospitalized across the Commonwealth. That number is down, but it is still exceptionally high, and we have quite the strain on our healthcare system. The trend in the 14-day moving average of number of hospitalized patients has increased by over 4,000 since the end of September. So, again, we're seeing a downward trend. While it's small, something that we're feeling positive about. That's just a quick brief about COVID generally. I also would be really remiss if I did not mention our COVID Alert PA mobile app. I can drop the link in the chat box. It's something we're really proud of, is the app. You can download it on your phone. If you have not done so, or your team, your staff, please join the app, download it. It is a really great tool in our toolbox for our contact tracing efforts. So it uses Bluetooth technology, and there's way more info on our website, but please download the app. Before we start talking about COVID vaccine, I also want to make sure that I encourage everyone to get a flu shot. If you haven't done so already, we are at the height of flu season here over the next several weeks, and it's really important to help keep our healthcare system in good shape, is that no one is going to the hospital for flu. So if you have not gotten your flu shot, please do so. So the COVID vaccine really is what everyone wants to talk about. We really see this as a light at the end of a long tunnel. We are receiving very limited quantities of vaccine, which I will discuss in just a minute. But first, I wanted to make sure I discussed the two different products that we are currently receiving from the federal government. So we have the Pfizer product, which I'm sure you've read about, is kept at -80. So the cold chain is incredibly important for this vaccine. It has to be handled very specifically. It's difficult to administer. It's difficult to distribute. This is a hard product to handle. So it must be kept super cold, and it also comes in trays of about 975, almost 1,000 doses. So it is really important that that vaccine gets to people who know how to handle it and can distribute it quickly and efficiently. The other product that we are working with is the Moderna product. The Moderna product is kept frozen, which is not unusual for those who do immunizations, and it comes in packages of about 100. So it is far easier for our pharmacies, federally qualified health centers, or others who don't have that exceptionally cold storage capability This is really the high demand product that we have. Our team is keeping a really close eye on the Johnson & Johnson developments. They have a single dose vaccine, which would be a game changer for us here at the department and across the country, really, to have a single dose vaccine that is does not require, exceptional cold storage would be something that would really change the landscape for us. Each week, we post on our website our vaccines and where they go. I can drop the link for that in the chat box as well before I leave, so you can take a look at where vaccines are allocated to. Our role here at the department, we allocate vaccine to vaccine providers, and then providers give that vaccine to people. So we are not actively determining, our team isn't giving shots, we leave that to our expert providers. Something else that's really important to our vaccine allocation and distribution project here is our plan. It is on our website, is the 5th version of our interim vaccine plan. Our most recent update aligned the plan to come into alignment with the recommendations from HHS and Secretary Azar when he was still in that role, that we begin to vaccinate those who are 65 and over and those who have certain medical conditions. The vaccine plan was updated to reflect that, along with the other documents on our website. Our website, again, is a really good reference point. It has many fact sheets and information about vaccine. It also includes a provider map with different buttons that are red and green based on where the vaccine is throughout the Commonwealth. We know that map is imperfect, but we're working on a second update and more updates to come to make it more user-friendly and easier for folks to have access. So I guess let's talk about that. Access generally is very difficult. Just this week or last week, we received as a Commonwealth about 140,000 doses of vaccine. Those of you who are big sports fans will know how many people fit into a stadium. Beaver Stadium, if you're a Penn State fan, holds about 100,000 people. What we've received in terms of our vaccine each week fills Beaver Stadium plus the parking lot. It's a very small amount of vaccine for the entire Commonwealth. Something else I'd like to mention is that Philadelphia County is its own vaccine jurisdiction. That's not unusual for those who have states who have big cities. So Philadelphia is its own vaccine jurisdiction. They receive their own funding, their own product, and they have their own plan. Our vaccine program covers all 66 other counties. So that's, we distribute to 66 counties while Philadelphia manages its own. Our information on where vaccine, like I mentioned, can be found on the website with a distribution spreadsheet each week. So we do receive a very limited amount of vaccine, and I think maybe the next place to go in this conversation is to discuss the pathways which we push that vaccine out to the public. We are starting with our federal pharmacy partnership. That is a partnership that we have entered into with the federal government along with CVS and Walgreens. CVS and Walgreens vaccinate those in long-term care facilities. Here at the Department of Health, we regulate skilled nursing facilities. The Department of Human Services oversees assisted living and personal care homes. And all three of those facility types are included in the federal pharmacy partnership, with CVS and Walgreens setting up clinics and going on site to vaccinate those who are in those types of congregate care settings. We do know that the Department of Human Services has even more facilities that they regulate, that they work with regularly, and they have partnered with Rite Aid to vaccinate additional long-term care and congregate care settings that they work with. They've partnered with Rite Aid. They put out a press release about it last week, I believe. So that is our federal pharmacy partnership for long-term care. We also have our federal retail pharmacy partnership that we are working with Rite Aid and with Topco pharmacies. Topco pharmacies are if you're from Central PA, they're in Wise Markets and Wegmans. From the Southeast, they're in Acme's. and Southwest there in Giant Eagle grocery stores, along with many smaller other places, but those are just some of the big recognizable names that many people know. We have worked with Topco and Rite Aid to push vaccine to those locations so people can access the vaccine in their community. We do know it's limited. We are not able, with the quantity we have, to be able to distribute vaccine to every single Rite Aid. I think we'll get there. We're just not there yet. Vaccine also is shipped out. So we have both of those pharmacy partnerships, and then we also have our enrolled providers outside of those other spaces that we work with. That would include health systems, hospitals, federally qualified health centers, smaller pharmacies, other practices. And those folks become enrolled. We have a whole provider section on our website on how you can become an enrolled provider to receive vaccine. There's quite a heavy lift for many people to get enrolled, have the data reporting capability. So all that info is on our website. Just because the provider is enrolled does not mean that they will be able to receive vaccine at this time because of our limited supply. We are also working closely with our colleagues at PEMA. I'm actually here at our command center at the Pennsylvania Emergency Management Agency. We're working closely with them on what targeted and mass vaccination clinics can look like. We have very limited vaccine, like we've been talking about, so we are not able to stand up mass vaccination clinics like you think of, with many, many lanes of cars at an arena. At this time, we are looking at doing targeted vaccination clinics for maybe counties that don't have coverage or providers in their space. So that's something we're working on with FEMA, and we hope to expand that project to be able to stand up more targeted or mass vaccination clinics as we receive more vaccine. Further, another project that we are working on that is slightly more long-term is we're also working with FEMA and with vaccine vendors who are potentially capable of partnering with businesses, with employers to vaccinate employees. But that, is further down the road. We want to make sure that we're able to give the product to an occupational health vendor or something along those lines in order for them to work with employers. Right now, we just don't have the amount of vaccine that we need. Something before I open up for questions, I really want to highlight that we hear a lot about how people are not getting vaccinated, they're not having access, but over the past 32 hours, we have an increased number of people who've been vaccinated of 57,598. So that's nearly 60,000 people in the Commonwealth who are, well on their way to being protected. So I think it is happening, but we're being thoughtful and methodical, and we are limited by what we receive. So Kevin, I think that's a pretty brief, maybe a pretty long update, but if there are questions, I'd be pleased to answer them.
Megan, that's been really helpful. We've had a couple of questions come in, but I guess one of them is, since Phase 1A has been expanded to include over 65, and so the demand as far exceeds the current supply. What do you recommend to people in those categories? Should they be constantly monitoring all the different sites because I believe you have to apply at each location separately, is that correct, in terms of the Rite Aids and the CVSs?
Right. Yeah, I think, looking at the providers that are in your community, utilizing our provider map on the website, and then working through those folks where you live is a really good option. I think we're working on improving the provider map on our website to do a better job at helping people figure out what to do, where to go. So I think more to come, but yes, we do not have a statewide central registry. We're asking people to work with the providers in their community.
Awesome. And the difference between the red dots and the green dots? What is it?
Yeah, sure. So the red dots are facilities who are enrolled providers but do not have vaccine at this time. The green dots are places who do have vaccine, Now that's tricky because at the moment that they've let us know they have vaccine, it could be, their appointments could be taken up several hours later, and then when the map is updated again. So I know it's imperfect, so we'd like to improve the map with some more real-time data, and we're working with our tech team to try and get that done this week.
Okay.
So hopefully more to come on that.
Great. And a lot of people are asking for information about your website and so maybe if afterwards, if you were able to email me any good links, we'll make sure everyone on this call gets those, or you can put it in the chat too, in terms of the sites.
Yeah, I'll follow up with you with an email with a bunch of things. I think that might be better.
Yeah. And then just to clarify for some folks, so once you get your first dose, are you automatically enrolled to get the second dose?
So it depends on the provider. Some people are making first dose appointments and second dose appointments at similar times. Others have different systems. It depends on how they're operationalizing within their own system. But you should get a second dose. You do not have to get it at the same provider. I think most people find it easier to schedule with the same provider, someone they know where to go, where to park, how it works. I think that's generally easier, but you do not have to. But we absolutely want people to get the second dose. I know the UK has had a strategy, and maybe other states have had a strategy where they have not, they have a single dose strategy, and that is not our strategy. Our belief here with our clinical staff is that 2 doses is important.
Okay. And the question, there's a bunch of questions coming in, so I'm trying to keep track of them.
Sure, yeah.
So bear with me a little bit. Someone mentioned that their company, so again, there's a lot of HR people, their company is a 1B essential business, and I think they've applied to the county. You have any sense of when people would hear if they're approved in those categories? Is that is that a county or a Department of Health decision?
So I think probably what you're talking about is, so maybe let's break it down into a couple things there. So those who are in 1B, I know many folks outside of the healthcare space in terms of their industry do fall into 1B or 1C. We don't know when we'll be turning on, activating, implementing, making eligible, any of those terms, for those in 1B. Please keep an eye on our website. Please keep updated with the Department of Health information. Right now, we have an exceptional amount of demand and very limited supply with our 1A healthcare providers and those who are over 65 or have certain medical conditions. I'm just looking in the chat. I see that there's, how do people sign up? Would a 70-year-old or a 50-year-old be in the same category? The CDC added those certain medical conditions because people with specific illnesses are more likely to get sick and die from COVID. So we have put in our plan, at the very end of the plan, there is a decision tree for providers to help make a decision on who and how they vaccinate. But really, it's very important for us that none of the vaccine is going to waste, and that those who make appointments, who might have a medical condition or fall within the specific age bracket or industry, that they do get vaccinated. We really want the shots going into people's arms. It's really important that, we've put forward these guide rails, but we know that the 1A category is quite broad at this time.
And about getting them into arms, I think one of the things people in the 1A or employers in the 1A have experienced is not everybody's comfortable with the vaccine. Their employees. Are you getting the sense yet of how prevalent that is within like a hospital system or nursing home, and what are employers doing about that?
So I think, at this time we have significant demand, but there will come a time, hopefully sooner rather than later, when we have turned the corner and all of those who want to get vaccinated, who are incredibly comfortable with the vaccine, will get vaccinated. I think addressing vaccine hesitancy is going to be something that we have to work through in a couple weeks, months. And I think that's really an opportunity for me to come back and work with you all to talk about how we can encourage your employees, your staff to get vaccinated. We know there's many segments of people out there who are not comfortable But we've learned from the FDA and the CDC that the vaccine is incredibly safe. I personally will be taking it when I get the opportunity. I am in 1C as a public health professional. So I think that's something that we'll be looking to any partner we can work with, including you all, to help us make sure that when we start to see things, the absolute demand die down, that we'll be needing your help to message to your staff that it's safe and we need more people to get vaccinated.
Yeah, and I know employers really want to support the messaging, and a lot of the chat's been coming in about how do we incentivize employees. So anything that you do come across that you want to have conveyed out to employers, please look at us as a channel for that. Because
right now we're really preaching patience.
Yeah, no, I understand.
We know it's really difficult, and we're really preaching patience. Our goal here is to ensure that everyone who wants a vaccine gets a vaccine, that they are safe, and vaccine is safe. That's our absolute goal, and we know it's really difficult when people see this as the light at the end of the tunnel and the ability to get back to normal. And I see some questions here. I am not a clinical person, but it is my understanding that, that the vaccine protects you, but you are still potentially able to transmit the virus to others. So those public health protections, like wearing your mask, washing your hands regularly, staying home as much as you can, going grocery shopping once a week rather than 3 times a week, and some of those things, I think we'll be working on those public health practices for quite some time. I did see a question in here about proof about a medical condition. The department's goal really is to bring down barriers for people getting vaccinated. Providers may ask for proof, but we have given very broad recommendations on how that should happen. For instance, when we were in the more narrow 1A category of healthcare professionals, we know that not everyone has like a hard badge ID, that you might be a different type of employee, and not everyone gets, say, a paper pay stub. So we want to bring down as many barriers as possible and not have to have people go above and beyond to prove that they are eligible to be vaccinated. I think whenever you go anywhere, asking for a form of ID or something along those lines is normal, but exceptional barriers is not something that we are looking to do. We really want to make sure that receiving the vaccine is as easy as possible for folks.
Yeah, no, that's great. You mentioned J&J's vaccine earlier. Is Pennsylvania reaching out directly then for doses, or is it all coming through the federal program at this point?
All of our allocation comes from the federal government. It all comes through Operation Warp Speed, which is now called just the Operation. All of our vaccine comes from there, and then it actually it doesn't even come to us to then have us ship it out. Orders, allocation requests are placed with us, and then we go through, look at several different data points to figure out how much vaccine each different enrolled provider might receive, and then it is delivered directly from the manufacturer. So it doesn't pit stop with us. It eliminates any risk of something, an additional set of hands, making sure it gets where it needs to go as safe as possible.
Well, Megan, I appreciate this. I know you have a hard stop, so I just wanted to confirm that the best thing for folks to do is to keep checking to the Department of Health site for updates and information, and the map is really useful. And we'd love to have you back again when it makes sense to give, I think as we come out of 1A into the other categories, it'd be great to get an update for all the employers that are in those categories, in 1B and 1C and so on. Yeah,
absolutely. Pay attention to our website. We're doing our very best to be as open as possible. We don't see when there are changes. We're very thrilled that Dr. Levine has, hopefully moved on to her post in the federal government, but Secretary Beam, our new acting secretary, we want to talk about it. Something we're really excited about, and we don't want it to be a secret. So when it comes to that, we'll absolutely be sharing the information, and I'm pleased to come back another time. If there's more questions, Kevin, if you collect them, I'll do my best to answer them, or at least provide the documents to help folks find the
Yeah,
answer.
that'd be great. We do this every week, so maybe we'll kind of check in, and if there's something new you want us to pass along, even if you're not speaking, that'd be awesome. Well, thank you for all you're doing. I know this is a trying time, and you guys are doing a great job, but I appreciate you jumping on like this with us.
Of course, thank you. Yep, I'm pleased to come back, or if there are very specific questions, we could bring a clinical person on. So just keep me posted.
All right, take care. Thank you.
All right, thank you.